Hello, my name is Dr. Narjis Duma. I'm a thoracic oncologist at the University of Wisconsin in the United States. We're taking a few minutes to talk about how we can use social media to connect with other specialties within oncology. This is reference to the review article that was recently published about leveraging social media for the use of cardio-oncology. As our patients are living longer with cancer and they are receiving new treatments, cardio-oncology has emerged as a new specialty in which multidisciplinary approach is necessary. One example for cardio-oncology are patients with lung cancer that are taking EGFR inhibitors like osimertinib or erlotinib. Both of those drugs have been associated with heart failure and electric abnormalities and EKGs or reading abnormalities. As a medical oncologist, I'm very familiar with the prescription of the medication, but I need my colleagues in cardiology to co-manage my patients. Particularly in the setting of COVID-19, social media has helped us to develop these collaborations in which one brain is not enough to be able to treat our patients. Social media like Twitter has allowed me to connect with colleagues in cardiology to develop studies. In conjunction with Dr. Patel from the Mayo Clinic, we have the largest case series about heart failure in patients with EGFR. These patients with EGFR mutations and lung cancer that were in targeted therapy did not have any other risk factors for heart failure. But thanks to social media, we were able to connect to develop this study and to publish the data that we hope we help other oncologists and cardiologists across the globe. One of the benefits of social media is not only about collaborators, but also to connecting with patients. Connecting with patients is detrimental. Why? We need to hear their voices. They are experiencing the cancer, we're not. Their input is invaluable, not only for clinical trials, but for study design, for study recruitment, and to make sure we're asking the questions that matter to our patients. As a researcher, sometimes my idea sounds great in my head, but thanks to social media, I'm able to explore those ideas with my colleagues in cardio-oncology and my patient advocates to make sure that idea is tailored to reality. I want to invite everybody to review this article because the current pandemic, I think it's important that we leave the traditional channels and we expand our network beyond our institution, beyond our specialty. Crowdsourcing has been the source for many of the new COVID-19 studies. One example of that is the Cancer COVID-19 Consortium, or CC19, that all studied via Twitter interaction. But circling back to the cardio-oncology paper, I think it is important that we work as a team and that we use what some people may consider unconventional routes to connect with our colleagues and advance the care of our patients with cancer. Cardio-oncology is no longer a cardiology specialty. They need our input as oncologists to work together and to make sure survivorship is taken into account. I thank BJ Oncology for letting us just share information about this article, and we are going to provide the link close to this video for people to take a look as well. Thank you.